Call a meeting to order at 7:31 on January 13th, 2025. We will start with approving the last meeting's minutes. I'd be happy to entertain a motion to approve those.
Hi, it's Sally Connolly.
Hi, Sally.
Sorry.
Sally, we're just approving the last meeting's minutes. We have a motion by Mark. Just need a second.
Sorry, I missed that. Oh, to start the meeting?
No, just approving the last meeting's minutes.
Oh, the last minute. Yes.
Yeah.
I approve.
We have a motion and a second. Is there any discussion? No. Okay, seeing none, is there any opposition to approving the minutes as presented?
No.
All right, there's no opposition, so the meeting's passed, or the meeting minutes passed, rather.
Okay.
Next topics are our reports, so we'll start with Sam.
Sure. I'm playing both roles, so let me get who first and seconded that. So it was Mark and Sophia. So just Mark, Sophia Penley, Mark Hotchkiss.
Very nice to meet you too.
Sophia was at Sacred Heart. Now you're a public health professor down in
at Mount Sinai.
Mount Sinai. Okay.
That's right.
Yeah.
Wow.
And Mark, you're a pediatric nephrologist, right?
An adult.
Adult nephrologist. Okay.
Yeah.
All right. So my report.
I mean, private practice, but I'll go first. Everywhere.
So I thought I would typically start with, so what's going on around here in the state? So this is kind of what's going on with COVID, influenza, and RSV. With the purplish being RSV, it's kind of leveling out right now. And you'll see COVID is slightly going up, but influenza is rapidly going up right now. And then you'll see like hospitalizations continue to increase for all of them at this point. What we have been focusing on a fair amount of time in terms of lots of CDC and state webinars is all looking at H5N1 activity. So I thought I'd give a brief overview of sort of some of what they're sharing with H5N1 activities. So 66 human cases so far in the country. There is no incidence of human-to-human transmission. We have 2 cases of unknown origin. So all the remainder, 64 cases, were associated with either dairy cattle or wild birds or backyard flocks or commercial poultry farming. But we did have this past week 1 death associated with H5N1 in New Orleans, and that was also the first. He was also the first severe case of H5N1, and he did pass away from that. But still, no person-to-person spread. They're still saying the risk to the general public is still low. They do have on hand 5 million doses in vials of vaccine that is, what do they say, cross-reactive with it. Like it shows some effectiveness from the candidate stock virus that they have. And then they have another 5 million that should be available in March, or by the start of March. So they'll have 10 million doses on hand. They haven't made the decision to move with vaccinating poultry or dairy cattle workers, which would likely be the first group, because aside from this 1 case, that nobody's had severe illness. And so few hospitalized and nobody with severe illness. Show just sort of here's what's going on with wild birds since January 1st, 2022. So you can see they're everywhere. Positive wild birds, 61 in Connecticut, 23 in Rhode Island, 467 right in New York. Of wild bird testing, they tested 10,948 birds. So commercial flocks by state, this is the last 30 days of where, it's being updated as we speak. This is where it's happening, sort of most recently where commercial flocks are being affected. Almost 11 million birds affected, 51 commercial flocks, 51 backyard flocks. This is, you can see here the types of animals they're talking about, wild and captive mammals, and distribution throughout the country for testing positive for H5N1. And so that's what's going on, where everybody's being vigilant. The case in New Orleans showed some signs of mutation, but that it happened. He had a backyard flock. They tested the backyard flock. That mutation wasn't found in the birds, so they feel like the mutation occurred in the individual, and there was no person-to-person spread related to him. So they feel like potentially those mutations are, that showed some indications of, being more transmissible, but nothing overly concerning with that, other than it was a mutation that would potentially make it more transmissible. And so they're keeping an eye on this. They're doing lots of testing of all sorts of things, of raw milk and regular milk, and raw cheeses and birds, and so we're getting sort of weekly updates from CDC and from the state between the two. And then I thought I would share a little bit of what's going on in town in the past year in terms of, these are communicable disease reports to Fairfield for the last calendar year. And you'll see, I'll pull down to here where below the zero. So some cases of Campylobacter, which is very typical. It's one of the most prevalent foodborne illnesses that we'll see. 947 coronavirus infections, a few sort of smaller ones, Cryptosporidium, cyclosporiasis, 2 E. coli cases. And we'll see some of these other ones down here. 698 confirmed influenza cases. So this is based upon people who actually went to a lab and did a lab test. And so that number is definitely 10 to 15 times higher, most likely.
Yeah, but I think Group A strep, you only had 2 cases up there. I mean, yeah.
What's the time frame for this?
This is calendar year 24. So January 1st to December 31st.
So is this reported to the town that the patient lives in, or where it was actually tested in?
Where they live, yeah. Yeah.
Interesting. Like, I think these numbers really
My whole
don't add
family
up.
had strep, so that's
Yeah, right? I mean,
Yeah, it doesn't get reported.
yeah, but I mean, if it's being tested
But it
in a
could
lab.
be delayed.
Was there a lab test done? Like through
Oh.
Quest or?
Yeah, they did it at the urgent care clinic on the post room.
But they took it like,
They
it
did
wasn't like
it
a
could have been a
rapid.
rapid. No, it could have been a rapid.
Yeah, so the
Okay.
rapids don't
They don't
send out.
report them?
No, the state just kind of said, we don't need the
We know that
results of
strep
rapids.
happens. Okay.
We're just going to do the lab test because the labs do it electronically. And so it's kind of a relief to the physicians. And so they, but these are all ones that were actually sent to the labs. And again, everybody knows that, yes, the numbers are higher than what we see here.
Mhm.
Even like Lyme, I mean, only 36 cases of Lyme.
Yeah.
I don't know.
Yeah.
In
Incredibly low.
Fairfield.
In Fairfield, yeah.
In
This isn't the state.
2024.
Yeah. So, and then some of the big numbers, RSV, pertussis, we had, I think we shared earlier in the year, we had some cases of pertussis in town. RSV, 275 cases, 10 cases of Salmonella, Staph aureus, that's always present, and a couple cases of varicella. And we did have some yersiniosis over the summer. So that is sort of what's going on, 2,082 different diseases. We don't necessarily follow up on all these, but we have, the foodborne illness ones and TB and a few others we'll follow up on. So that's sort of some of the picture of what's going on. In terms of what I've been doing with the department, so we've had a big effort by the First Selectman's Office to initiate a Safe Streets campaign. I think I may have shared a little bit of this in the past, and they've asked us to play a part in that, and which we've been doing through Santina's work for years. The health department used to receive about $15,000 a year in community development, community block grants, preventative health block grants. And we would dedicate that funding. We would basically say to the Bike Ped Committee, you tell us what you want to do, and we'll work towards that in terms of making bicycle and pedestrian improvements. We'd work with engineering to sort of say, what's your list of things, and where can we do things like connecting sidewalks and to make longer, making the town more walkable. And so we've been working towards that effort for years. And so we are part of this Safe Streets, I think we're calling it the Safe Streets Alliance. So it's members of the Bike Ped Committee, members of the board, the school, Fairfield Public Schools, Public Works, Police, First Selectman's Office, and there's a few others on there that basically we're working on a campaign to promote both people not speeding, driving more safely, driving more cautiously, and to also for the same for walkers and bikers and those on scooters and rolling in any kind of way to come up with a couple points for each group and have maybe a campaign over the next year or two of just sort of public relations type work, media pushes, and we'll work to secure some funding for that, and basically do a big push of trying to, with the point of modeling off of what Mothers Against Drunk Driving did for drunk driving, how it's viewed as an extremely negative thing to, drink and drive. And they, their efforts really brought that about. And we're hopefully trying to do the same thing for street safety, to get everybody to say, because we did have a death, 2 deaths in Fairfield related to vehicles and pedestrians. And so, so we're starting the work. We had a couple meetings this past month, and we're working towards sort of laying the groundwork of goals and sort of vision statement and gathering lists of organizations that'll probably work to support us and getting volunteers to help with some statistical pre-post surveys that we're thinking of doing, to capture information and stories that we can use about, experiences of Fairfield residents. So we're still at the early stages, but we hope to be rolling out some content, at least sort of social media content, coming up soon. To that end, we did have on the 13th of January, myself and several of the department heads and the first select person and the elected officials, state elected officials, were up on Reading Road at the new circle. I don't know if you've seen the traffic circle up there. So they, at the intersection of Reading and I think it's Dunham.
It was like a triangle before, right?
Yeah, it was basically this weird intersection, one road coming down, one road coming down, and it was like 2 roads going into one, just before Dwight School, if you're going north on Reading. And so they've installed a traffic circle to promote slowing, to get people to drive slower. They've done some rearrangement of the lines on the road to make them make the driving lanes a little narrower. That research shows that helps slow traffic. And so that we had a vision, what's called a Vision Zero, where the town has the vision of having 0 pedestrian vehicle incidents. And so we're, signing a pledge to say we'll work towards that. And it's in line with the work that the health department's been doing for a long time. And so that's been a fair amount of the some of the efforts outside of the typical inspecting and other things that we're doing. This December, usually Christmas week, we send out our license renewals for all our food service establishments. So that's, a lot of several days of stuffing envelopes and staff sitting there and, sending them out, and then now we're starting to get the deluge of, 500 or so applications coming back in and checks and, trying to make sure everything's getting deposited the way it should. So it's January ramps up as a busier time with that going on.
There's not an electronic way of doing that?
We are working towards that. So the database that we're working on is we're hope to do that. It's and we're talking to figure out do we have to legally mail a written notification, which our programmer, has said, from the company that we're working with the database says every other town that he's worked with has said they have to mail it. They have to be a physical mailing.
Or maybe you can send e-requests up until a certain point, and then if you don't hear back, then you have a smaller group to mail to.
Yeah, and so that's, we're transitioning to this new database. The transitioning has been going very slow. The company we've been working with has not been very responsive to us. I mean, the building department, fire marshal, zoning are all up and running in it, and so, but because their system is the same for all three of them, they just go in and review the permits that are processing, and we do that as well. Our inspectors log in, and every day when they have office hours, they check, see if are there any building permits that we have to approve. But since it's also doing, it's also taking care of our administrative aspects of our health department in terms of licensing and issuing certificates for qualified food operators and, a bunch of different aspects that we're adding to that, that it's a little bit more complicated, and to help that the state switch to the FDA food code, which we've talked about, and that company still, while they still have other health departments that use their software, they haven't developed the FDA food inspection form in the new software. So it's even if we got the new software, we still couldn't do tablet-based inspections. We would still be working on paper as we are now. So we've had the first conversation about reaching out to the town attorney to potentially put some fire under the company to be more focused on us and kind of get us over the line. We've been working with them for, I want to say it's almost 2 years now.
It's so fun.
And we don't have anything. We're still using our old, we're fine. We're still using our old system.
But the money that's being invested in that, paying for service you're not getting, I assume. Right?
Yes. Luckily, I think, according to the folks from IT, we got a really good deal. So, there wasn't that much money to them. They were like, oh, this is nothing. I'm like, well, let's go for it, And so, and they're taking care of all that, so it doesn't come out of the health department budget yet. But there will be likely some maintenance costs once we launch it. So we're still hopeful. We're still working. We have 2 staff that dedicate a significant portion of their time to just that. Mary, who actually worked on the transition from the previous database to the one we have now, so she's very familiar with all that. But again, it's slow going. It's painful. It's and we're not the only ones frustrated. The IT department is just as frustrated as we are. Also, we did. I think we've talked about our community health assessment that we did with the well-being survey, community well-being survey, and the community-based needs assessment survey, CBANS, right? I get it. I headed all the letters there. And so what we're promoting now, and I'm not stealing this from you, are you?
No, it's okay.
No? Okay. So, and what's the name of the one now, this survey?
It's the priority list.
Yeah, so right now we're sending out another survey. It's up on our social media, and we'll probably send it to you in a day or two, or tomorrow.
The email hasn't dropped it.
So, we peppered you with emails about fill out this CBAN survey and answer the phone if you get a call from the well-being survey. And now we've got
the Community Voices Survey.
Community Voices Survey. So now we've got sort of what are the top issues that kind of rose to the top of that. survey, and then part of this is asking the community, what are priorities to you? And so that's what this survey will get. We're already close to
Is Data Haven doing this too? This is part of the.
I don't think Data Haven is doing this one. This is another consultant that's doing the Community Voices survey.
Okay.
Data Haven did the C-bands and the
Right.
community well-being survey
Yeah.
for us. And so we'll launch this one. We've got about 500 responses already. We'll get some more, and then we have a public prioritization session at the end of this month with all the members of the Health Improvement Alliance. And that will go through a process there with a consultant will run us through a prioritization process and including the results of the survey. And then once they set the priorities, then they will develop a community health improvement plan based upon the priorities. And then each task force that we have for each priority will take on their part and develop goals and objectives and work our way through that. So hopefully by late next spring, we'll have that kind of whittled down to paper and a report, and that we can then we'll incorporate that into our next strategic plan that we'll start working on sometime later this year for the health department. I did participate. We had an all-day session up at Sacred Heart in the GE building there. Very nice. That was building community partnerships meeting about emergency preparedness and building community partnerships with a special focus on communities, faith-based organizations. So lots of the churches in the area were there. Lots of faith-based charities. And then also other emergency response entities like, Salvation Army and American Red Cross were all present. We even had Channel 12 News there as participating on one of the panels about, essentially they were just sharing like what's important for them to help for us to get our word out about issues. What do they want? What are they typically looking for? And so it was one of the gentleman I see, every time I turn on Channel 12 News, there's a gentleman there, and it was like he was right there. So, but it was actually very good. And so, but it's, starting a step. We've over the years, we've met with different, in Fairfield, different faith-based groups and the Clergy Association of Fairfield, and it's while they're always willing, and we've worked with several churches to be cooling centers, heating centers, charging stations, and they're always willing. It's kind of hard to it's hard to pull them into an emergency response activity because a lot of times they're just busy with their parishes, but they do offer a lot of resources over the years and work with us in a lot of ways. But that was it was a very good all-day seminar. And then on December 19th, and we're waiting to hear on the results when the nominations come out for the Grammys. But we had the No Talent Required Choir, organized by the Health Department, perform at the Senior Center. And so we did a rendition of what was the song we did? But we did a customized vaccination song, Christmas Carol, lyrics rewritten, Santina.
Well, we have that recorded somewhere.
Yes.
We do. I also sent it up to the state.
Yes.
They got a great kick out of it.
Okay, good.
So
You sent the lyrics too, right?
it's in the lyrics.
In case
Have
you wanna do it.
yourself a COVID-free Christmas.
Have yourself a COVID-free Christmas. And so we did
That's great.
and we covered all of the vaccines, the top ones. But it was, we had a fun time. We had the first selectman read, "'Twas the night before Christmas, and all through the house not a creature was stirring, not even a mouse." And then he would go off track and be like, "Except for our policemen and firemen who were packing it up and be at work, even on Christmas," and then every, couple lines he would pause and go off track. And so take off on a Saturday Night Live skit. But, and then we did a couple songs to close it out with about 20 town employees you know, and so it was a fun thing to organize. It's, you know, sometimes that's the fun part of the job, is getting to do those types of things. You know, they did ask us back, so it wasn't that bad. You know? We were wondering if they'd ask us back this year. This is the second year, and we were wondering. But it's that senior crowd is a difficult
I
crowd.
bet they're really hard to win over, like teenagers.
Yeah, it's like, the look is kind of like, listen, we're eating here, come on. But I did see a few of them get up and dance and, you know, sing along, and so that was great. The town has hired a new grants coordinator, and so we're happy for that. Just started a few months back, but he kind of said he started a few months ago, but nobody's really seen him, and so I think he's just been familiarizing himself. But at the last department head meeting, he kind of came out, and so Santini and I are meeting with him this week to kind of review our grants. And so I think it'll help us, and one of his roles is to be looking out for grants and assist with applications. So that'll help. We think that's a positive step for the town. And then lastly, you know, we're in the start of the budget process, and so we submitted our budget to the finance department, which is basically level funding other than contractual salary upgrades from the collective bargaining agreements. You know, we've basically asked for level. We moved a few dollars here and there around, but it's basically, in terms of overall dollars, it's a level budget. So we'll present that in next week to the first selectman, and so hopefully we'll move forward relatively unscathed. Last year it was an easy year, but they did warn that this will be a tough budget year, so we'll see. But anyway, so that is my report.
Any big kind of, I guess, dreams that you would like to have put in the budget, maybe, that maybe for future years we can work towards? I mean, anything you'd like to see be done that's new and innovative or different, or that might add budget line?
Yeah, and we've been having this discussion. So as you've noticed, there are a lot more apartment buildings in town and going up and more proposed. And so they, you know, in a couple years, there will be something like 2,000 more rental units in town. And so we have a requirement that every dwelling that is rented has to be inspected and receive a rental certificate. And so that we've been managing okay to date, you know, but I think this big push might necessitate, you know, some additional personnel to take that on. And in the past, a long time ago, we had a dedicated housing inspector, and so but we converted that position years ago into a sanitarian. But we may have to do that. That's one vision thing, and we've been, you know, I talked with Rob about, you know, how are our numbers and working, and, you know, the numbers have gone up, but not significantly yet. But I think it's, you know, part of it is that some of the large apartment owners aren't calling us when apartments transition over, and so we're not aware of them. So, but we're trying to improve that compliance with them. But it's also, you know, that you know, some of the apartments that are in Fairfield are sort of, I think they're ending up being longer term than most people think. And so
is the requirement that every time it turns over, it needs to be inspected?
If it's greater than 6 months, okay. Yeah. So the certificate is good for the life of the tenant, but if the tenancy changes within 6 months, we just ask them to update the names of the tenants. And so anyway, that's one big vision thing. The other, and that we've already talked to the selectman's office about. They're aware of it. It's not now, but we've kind of said at some point we're going to come to you and ask for a housing inspector. The other issue is our nursing office. I don't know if you've been there, but it's our nursing.
Oh, it's like it's a trailer behind the.
Yes,
I have, yeah.
Double wide trailer behind the senior center.
Okay.
And so it was the old alternative high school for Fairfield High, or Fairfield Public Schools, and it's basically an old trailer. It's got leaks. It's got animals that get into it, mice and.
There was something above my desk this morning.
Yeah, there's raccoons that get into the ceiling, and so it's lived its life, you know, it's well beyond its what was, you know, its useful designed life. And so the selectman's office is aware of that, you know, at some point we will need to find space somewhere else. And so that's, you know, sort of, if we're talking about vision, what in the future, that's something we probably need to do, because it's a weekly call to Public Works, would you say, of like, hey, this is what's going on this week, and after a big rainstorm, there's a few like buckets and puddles, and you know, so it's not what you think of a, you know, a clinic. Yeah.
We have a nice view. Right.
If it was subject to one of our housing inspections, it probably wouldn't pass.
Fail.
No, I'm teasing. It's a beautiful place, location, has a nice view, and aside from those issues, it's a perfectly workable space, and we do the best we can with it. Mm-hmm. And it provides us actually a fair amount of storage for us that, you know, a number of years ago we had the storage that we had here taken away, and we were given a much smaller storage unit, and then we were able to use some of that space over there for storage for some of our preparedness supplies. And so we've got cots and blankets and sheets over there, and a whole bunch of supplies. And so, but
what if there's grant funding out there to create a public health building? You know, if you're going to offer certain services, et cetera, you know, like I wonder if the state has money, or if there's federal grant money or anything like that to help craft something. Because I mean, I see kind of a larger vision here, right? If you can create a real public health center, the things that you could offer in there could be, you know, just innumerable, right? Run different, you know, health clinics and other services that aren't provided now potentially, and, you know, more than just vaccinations, but things that some of our folks that we've talked about, some of the Data Haven research, you know, some of the things that they're lacking.
Yeah.
Maybe so that could be offered there too. I don't know.
Yeah, I mean, it's, I think, you know, I did, you know, jokingly throw my hat into the ring for the Turner Army base, you know, Army Reserve base on is that High Street? Mm-hmm. You know, but I think they have other plans for that. You know,
please, for how many years? Like 20 years now.
Yeah. So, but I think I'm way down on the totem pole of, you know, who's going to get to use that, you know, and so, but yeah, there's just not a lot of free town space at this point, you know. But as you're aware, they were talking about the Fairfield Public Schools coming into where Child's Garden was, and was a sort of an interim temporary plan that potentially they would stay there for a few years, and then while they secured the funding and all the plans to build another early childhood center facility. And then the thought at one point was, after the schools are done with that space there, that the health department could move next door back to the senior center where we had been prior to moving into the
which is a good spot for you.
trailers. Yeah. If we're on that other end of that hall, it's good in a lot of ways, and it would provide a lot of resources for us. Mm-hmm. You know, it's in an area that's high risk for flooding and those types of things. Although it's come pretty close to the building, it hasn't like gone into the senior center. Our portables are up, like in our.
Nothing's gonna take that
nothing.
down.
Yeah, nothing's gonna take it down.
There's some windstorms. I'm like, no way is this trailer gonna survive, but she's there.
The office is may drift out into the marsh, but you know, we'll pull it back. You know, just gotta wait till the die.
We go to the lobby. We'll start having conversations, right? We don't want to talk to them.
Yeah.
Here's what we need. You know?
I mean, you know, again, they're aware, and you know, even, you know, so the first selectman actually did his internship with us when he was doing his master's in public health, and specifically Santina was his proctor, and so one of the first things he said to me when he won the election is like, all right, when are we going to get the nurses out of that trailer? And so he's well aware of it. He's you know, been in the building for, what was it, 3 or 4 months?
Yep, his desk was in the closet.
Lived it.
Desk was in the closet, you know. So yes, he's aware of it. I think he has a spot in his heart for us. So I think we're just waiting for the right opportunity. You know, there's some benefits to having offices here, being close to the leadership of the town and being sort of having that access I think it makes things a little bit more efficient. You know, being able to walk upstairs with a grant report and say to the finance director, hey, can you give me a signature on this? And, you know, get it back in 5 to 10 minutes, you know. There's some benefits to that, but we definitely have, you know, hopes that we'll have a nice facility for the nursing staff and our community health program and, you know, our clinical programs and be able to. Right now we're, you know, we probably could expand somewhat, but right now we're kind of hindered with one clinic room, you know, and so without any kind of large spaces that we would need to run like sort of any kind of mass vaccination. So that was my report. So
Thank you, Ray.
yeah,
Santina, floor is yours.
Okay. So been busy. The two big grants that I manage are ELC2, which is our COVID money that has been rolled over, and our immunization grants. And so both reports were due and submitted on 12/15, and they were accepted. And this is probably the first time I didn't threaten to throw my computer out the window, and I was able to upload all of the documents and the budgets with no problem. So with the immunization, we've been busy with clinics. So as we were kind of talking a little offline, our numbers are lower than they were last year. So from 9/1/23 to 1/13/24, we did 1,630 flu shots. From 9/1/24 to today, we're at 1,278. And so our talks are always, is it because people are just more vaccine hesitant? Is it because you can go anywhere and get a flu shot now? Not really sure. But we are going to continue to offer it. So, you know, we had a really big push in the fall through December, and then our clinics kind of died down, so we stopped offering it. But as influenza is back on the rise, we're going to offer a Tuesday evening clinic, January 28th, walk-ins, and see what we get. And if we start getting some good response, we will continue that. But of course, people can come in on Mondays or walk-ins, and they can make an appointment at any time. We are out of high dose, and we are out of FluMist, but we do have regular. And then we also offered COVID this year. So we did 241 in the season of adult doses, which is 12 and plus. And we did 24 doses for those 6 months to 11 years. RSV we offered for the first time for people over the age of 75, and we ran out of that. We got all 10. We've been talking about do we purchase more and offer it? However, we're not getting any phone calls about it, so we're just we let the staff know if you get any phone calls, let us know, and we'll kind of take it from there. It is a little pricey. And then, again, with the immunization grant, we were able to hire staff, a public health nurse and community health worker, and they were able to go do homebound visits, and they did 37 homebound visits. And we got even emails of people thanking us for that service this year, because that's not something we've been able to offer. We did it during COVID because we had the grant funds. And then we last year weren't able to offer it, but it's a good service that we're able to offer this year. And then part of the immunization grant is a media campaign. So Sands and I met with our marketing company last week, and this is a joint effort between us and Aspetuck, which is Westport Weston, Norwalk, Stratford, Trumbull, Darien health departments. We all pooled our money together to do some big campaigns. So the big campaigns to date were back to school. So we really did a push of kids getting their back to school vaccines, just the general fall, and then the holidays. And so there were TV ads, radio ads, on the train stations, on the billboards. There's a website.
There's our website.
We actually even took out an ad with Sally at the Ward High School winter program concert booklet. And so we've been really just pushing everyone to this website, and then will connect you and direct you to each of the health department's websites.
How are the hits on the website? Have you been tracking this?
We
Oh,
have
thank you.
So, and I can pass this along.
What a good setup.
Thank you.
So we've had over 5 million outdoor ad impressions, 3.8 million Google ad impressions, over 1 million Spanish radio impressions, 876,000 Meta ad impressions, 135,000 unique individuals reached with the Meta ads, 210,000 streaming TV impressions, 186,000 streaming audio impressions, 59,000 website page views. And then they are calling this really successful with over 11 million total impressions, 51,000 digital clicks, and 39,000 website users. So I think I can pass that along.
And those are unique users?
The 39,000
Mhm.
was unique users. So 59,000 or 52,000
52,000, yeah.
site visits, with 39,000 of them being unique visitors.
That's great.
So you all had lower than expected vaccination rates, but did other folks in the region see similar numbers, or did they also?
Yeah, everyone's down.
Everyone's down, okay.
And the point of our campaign wasn't even to get, obviously we wanted people to get vaccinated with us, but it was just to get vaccinated.
Sure.
So it wasn't, directly like, here's our
Here's how
clinic,
you can
which-
get it with
which-
us, right.
Yeah, which we did advertise, but, our campaigns were, let's get vaccinated.
The importance
Stay
of
healthy for vaccination.
Yeah, so we had, and since you haven't been here, we had the 3 pushes of, back to school vaccination, fall vaccination, getting ready for the flu season and respiratory virus season, protect yourself for the holiday season, for visiting families.
Yeah. So it was, really successful. We will do a push for travel clinics, our travel vaccines, for April vacation. And so that's even something, even though we don't offer travel vaccines, Norwalk and Aspetuck do. And so, again, just really urging people to get vaccinated.
Interesting, because I found it was actually kind of hard to get vaccines this year. I was searching around the CVS's, for example, to try to get my wife and son and I all done at once and get flu and COVID at the same time. Could not get them scheduled. I was finally able to do the Walgreens right on Kings Highway.
Should have came to us.
Well, I was actually...
aren't your feelings hurt a little bit?
I was a little bit early this year,
Okay.
and we had talked about it here, but you guys hadn't really ramped up yet.
Okay.
Because I was trying to get them done to accommodate
Yeah.
scheduling. But, CVS was really hard. I tried multiple ones and could not get in. So I don't know if they just didn't have a large product supply or
No, that's interesting.
if they were really all sold out. So, we talk about people going elsewhere, but were they going elsewhere? I don't know, because it just seems so much harder this year.
Yeah. Yeah, that's interesting. I wish we all had the answer. I don't know,
I get mine through work,
Mm-hmm.
and then the kids went through to their pediatrician.
Yep.
And I don't know where Shane went. I think he must have gone to a CVS or a Walgreens.
Yeah, and it's much more, since COVID, it's become much more acceptable. Oh, I just gotta stop in the pharmacy and
Totally.
get one, and, and some of them are really good about walk-ins, and, are they just, you just go on the phone while you're there, and it's a pretty quick thing.
Yep.
So we think that's part of it, is that more people are vaccinating now since COVID.
We definitely got a push, January 2nd, of all of the preschoolers that were told,
Sure.
can't come in.
That's
So
right.
the second and third, we had a
lot of kids.
a lot of kids, which we did reach out to the providers, and, we even did a clinic at the YMCA, let's try to be proactive and get the kids vaccinated. But I also think maybe some parents didn't know that the preschool was serious, and they wouldn't be able to come back, so.
And we even did an assisted living place.
Yeah, we did an assisted living, so we did residents and staff there as well. So we were really out and about, and our clinics, our bigger clinics, were not as popular as they have been in the past, but again, we were offering them every Tuesday evening, from 3 to 6. People can come and get a vaccine, as well as, any time on Monday. And, we had that new appointment system, online booking system. So, we were definitely busy and reaching out to people.
Yeah.
So, and then as far as other things, we are monitoring a few people with some communicable diseases right now. Tomorrow I am meeting with the state on a HALT program. And so this is all web-based healthy lifestyle, healthy choices programs. So we used to offer, or we still do offer, the Healthy Living program, which is a 12-week program. It meets on the evenings. The problem with that is after a while people just drop out, and we kind of sit back and say, is this really a good use of our time? So now the state came out with, it's almost exactly the same program, but it's web-based. And it's completely free of charge. So we did do an informational webinar with them, and I just kind of want to meet one-on-one with them just to find out a little bit more about the program. So I'm doing that tomorrow. Heart Health Month is coming in February. So every Wednesday from 9:30 to 3 p.m. we will be doing Know Your Numbers. During the month of February, anyone can come in. We're going to put it up on our booking system, so we're going to do walk-in and appointments, and we will do A1C, blood pressure, and height and weight for BMI. And then we are going to be offering it at our Diabetes and Chronic Disease Support Group on February 11th at the Senior Center from 1 to 2. And then we did submit our annual report with the state right before the new year. Mary did that for us. And then lastly, in December, Julie McCullough, the public health nurse, and I did QPR training at Sacred Heart University. So that's question, persuade, and refer suicide prevention. We were approached by a sorority to do it with her, sisters, and it was phenomenal. The kids were great. They asked great questions. They were really engaged. And I feel like this is maybe a population that we sometimes forget about, right? Like we're so focused on the school age, and we're so focused on, the elderly or, the parents, that we have 2 big universities. This is a huge population. So we're going to reach out to the universities and see if we can start offering.
I would love to have you.
Yeah.
I would love to, yeah.
I mean, it was
They would open the door for you, for sure.
But talk about like a good use of time.
Yeah.
We were there 8 o'clock at night,
Yeah.
but for them to be so engaged, and the stories that they were sharing were just absolutely heartbreaking, and each one of them had a story, and were looking for advice, if not for themselves or their family member or their fellow classmates. So that's a population that for 2025, that is our hope to start getting into.
How long is the program?
QPR?
Yeah.
It is an hour-long training.
Oh, that's it?
Yep. And then, it can go longer depending on questions we get asked. So we trained the entire staff here, and then we trained all of the fire departments. And then we've had a few on community ones. But there was just something special about that training.
She also has an MRC.
Okay.
Yeah, so that would be a good.
Do you have any contacts?
I do, yes.
An MRC is?
Medical Reserve Corps. So they're normally affiliated with health departments. After Sandy, there was one that was started at Sacred Heart. It was meant to be like a regional university-based one. There are very few university-based MRCs. I think there are maybe about 15 of them. But Sacred Heart still has one, and it was started in Sandy, and it was dormant for a while. And then during COVID, we had a huge influx of students wanting to join, and faculty and staff. I think we had somebody from the registrar's office who would volunteer at the vaccine clinics in Bridgeport, and so the students now I think are looking in non sort of active response time. We did mental health first aid training with them, and then we've done like Stop the Bleed training, but I think QPR would be.
Yeah, I would love any sort of contact. I actually participated in a focus group today with the Catalyst, And so,
Oh,
you know, we were
yeah.
talking about, you know, what we're seeing in our communities and stuff like that. And so I mentioned, you know, the QPR at Sacred Heart, and, you know, I saw everyone just kind of nod in their heads that, you know, this is a population that kind of sometimes don't focus on. Yeah.
A lot of high needs for them.
Yeah. And, you know, even mental health first aid, while that's a great program, that's an 8-hour-long training. Yeah. So they said that they are looking for some shorter, you know, I think QPR works because it is that hour long, you know? So they're looking at other training options.
Great.
Do you have a target size for the audience that you're bringing it to? Like, is there too big of a size?
Yeah,
Is it really
so-
intimate group?
We can only do up to 20 is max, 20 or 22. But obviously the smaller, the better. So like this group was 8, and, you know, they're able to share their experiences and, you know, talk it through and stuff. And so the whole point of the program is looking for, you know, the signs and cues that someone may be struggling, but then to get people to be comfortable and breaking the stigma of asking the question, are you suicidal? So it's a really good program, really effective. They compare it to like doing CPR in the program. So. And I believe that's it for me.
Cool. Thank you so much.
Excellent.
Are there any communications?
I have none.
I have none. Okay. Any old business to rehash?
I have none.
Okay. And we do have new business.
We do. So when we approved the calendar last month, historically we have the week of, our meeting falls the week of school vacation in April. And we've historically just bumped it a week later. And so when we approved the calendar, I accidentally put the wrong date in for April and was going to ask the board if you want to switch, you know.
I will be out of the country, so I'm good with that.
Good with switching. Okay, so I would just ask for a motion to move the April 14th meeting to April 21st to accommodate April's break for the Board of Health.
I propose a motion to move the meetings, what are the dates?
14th to the 21st.
To switch to the 21st of April.
Okay. We have a motion. Is there a second?
Second.
And a second. Is there any opposition? Okay, hearing none. Motion carries.
Thank you.
Thank you. Is there any additional new business?
I have none, other than to welcome Sophia to the
Yes.
Board of Health.
Thank for having me.
You want to do a 1-minute elevator speech on?
Oh, Lord. All right. I'm Sophia Penley. I am originally I was born in Chicago and then moved to Greenwich, Connecticut when I was going to 6th grade, and I lived in New Orleans for a really long time. We came back 2018 to Fairfield County to start my job at Sacred Heart, which was starting the MPH program, and then made the switch in 2023 to join Mount Sinai's Medical School. I'm in their Department of Environmental Medicine and Climate Science. I work primarily on their pediatric environmental health team. So we do a lot of all things related to kids and how the environment impacts their health, indoor, outdoor, extreme weather events, disasters, things like that. A lot of asthma. And so, yes, at Sacred Heart, I ran the Medical Reserve Corps, and so I still have, you know, a lot of connections there. But my public health research when I was doing my PhD was on disasters. So I did a lot of Katrina research in New Orleans, BP oil spill, all of that stuff. And I was in Haiti after the earthquake, so I've traveled a lot internationally as well, doing global health work.
Great, well, thank you.
Yeah.
Thank you.
Yeah.
Great work.
Might as well tell you about us. Mark, go ahead.
Yes,
So-
please.
Yeah, so I'm Mark Hotchkiss, and I've been living in Fairfield since 2004. My wife and my kids are now both in college. My daughter's about to graduate.
Congratulations.
That. Crazy. She's still 10 in my head.
Yeah.
21 in real life. And I'm originally from New York. And I went to medical school on Long Island at Stony Brook, and then I kind of circled. I did residency in Massachusetts and came down to Connecticut. I did nephrology training in New Haven. That's why I ended up here in Fairfield, because my wife works in White Plains. She's a federal prosecutor in White Plains. So we had to live somewhere between New Haven and White Plains. So we settled on Fairfield, and we're very happy that we did. So I'm in private practice. I've been in private practice for in nephrology for over 25 years now.
Okay, great.
And we work at St. Vincent's Medical Center in Milford and the two New Haven hospitals.
Okay.
So we have a lot of, and I'm the medical director of the dialysis right here in Fairfield on Kings Highway.
Okay.
And so that's
Nice.
my story.
Nice to meet you.
And I'm Jason Preplich. I was actually born here, but grew up in South Florida.
Okay.
I came back here 25 years ago now, for college, where I went to Sacred Heart, class of 04. My son is 10 in my head because he actually is almost 10. He'll be 10 in March. That's my wife and my son and I, and he's a avid little hockey player. We just travel the state playing hockey every weekend for the never-ending season. It just goes on forever and ever. I'm a PA. I've practiced for over 15 years.
In the emergency department.
Yep, emergency department, also pediatrics. I work for Connecticut Children's as well, but I practice full-time at St. Mary's Hospital in Waterbury in the ER there. And I adjunct at Sacred Heart and also at Quinnipiac, where I teach in both those PA programs. And I've been in Fairfield since college, and my wife's from Southington. She went to Sacred Heart as well, and we just love the town and
Did you
settled
meet
here.
at school?
Yeah. mhm.
That's awesome.
Yeah. I say she's the older woman because she's got 9 days on me.
Otherwise, she loves that.
Oh, yeah. Especially now that I have my son reminding her of that. I'm year old.
Yeah.
But yeah, we've been here ever since and love it here.
I have two kids in elementary school. They're both at Riverfield this year. Louisa is 9. She's in 4th grade, and Oscar is 5, going on 25, and he is in kindergarten.
Yeah, my son's in 4th grade as well over at Holland Hill.
Oh, cool. Okay.
Actually, one of his buddies used to go to Holland Hills over at Riverfield, Mateo Santa.
Yes.
Yeah.
Yeah.
Yep, they play hockey together.
Oh, nice.
Yeah, they're a great family.
So you take the train into New York?
I go once a week only. The rest is just on
That's
Zoom.
awesome.
They call my phone, like Zoom comes through the phone. Zoom's everywhere.
Very nice. Good.
But yeah, once a week. And then I was teaching in the fall, not teaching in the spring. So the fall it was once a week. Wednesdays typically is my day, so it was a little bit of a late commute back home. But I get off at 125th, so it's not as bad as going all the way down.
So the students that you teach there, so there's a medical school.
There's a medical school.
And is there any other allied health?
There's an MPH program.
There is.
And so the class that I was teaching as a course director was for the MPH program. I taught program planning, implementation, and evaluation. And but I also teach the pediatric fellows an intro to research course for their projects. They have like a longitudinal research project that they do. But then in the MPH program, I had medical students. There was also like a joint Master's of Social Work program with Fordham, so sometimes those students will come as well. Yeah. Yeah, it's cool.
Do we still have Henry and Sally on the phone?
Sally or Henry, would you like to do a
I
intro?
can say something, I guess. Hi, how are you? Sorry that I'm on the phone instead of in person, but just the nature of the day. But so I'm Sally Connolly, and I guess the background is I did behavioral neuroscience at Brown and did a master's in speech-language pathology at Boston University. I've worked as research assistant to kind of pay my way through both Brown and BU and psychoacoustics labs, and then ended up spending a year in Ireland on a weird grant working on how music acquisition is analogous to language acquisition. Some of you probably didn't know that, so that was pretty cool. And then came back and settled in Fairfield. I had grown up in Easton, so I've been a resident of Fairfield County my entire life, except for kind of college and that Ireland year. And I have 4 kids. They are 14, 16, 18, and 20. So 2 at Fairfield Ward and 1 at Platt Tech doing HVAC in the trade school. And the oldest is outside of Nashville in Murfreesboro doing audio production. So that's pretty cool. Little side note is that I'm kind of like the band manager for his band, the Low Darts. So keep your eyes peeled over the summer. They'll be playing at a variety of different locations. And and I work as far as speech pathology, I work as the physician liaison or like community liaison and speech pathologist in Fairfield County. So in addition to working with all of the area hospitals, clinics, doctors' offices, basically I help manage the referrals that come in and kind of make sure things go smoothly after a patient's discharge, and that the nurses or PTs or whoever opens them. And then I also see patients clinically, mainly in the Fairfield County area, but they've had some need here and there in New Haven and Waterbury counties. So I do cover that as well. So that's really like stroke patients, Parkinson's, and actually we are pediatric to geriatric. So my youngest patient right now is 2, and the oldest patient I've had in the last few weeks was 104.
Oh my gosh.
So it's pretty cool. I like it. It's diverse, and I see inside people's homes and kind of help advocate from the inside out. So that's my little 2 cents, I guess.
Thanks, Sally.
Very
Thanks, Sally.
cool.
Henry, you still there?
Yes, I'll keep it brief. I have
Hi,
the
Henry.
privilege of, hi, Sophia. I have had the privilege of working with Dr. Pendley in the past as part of Sacred Heart. And the comment that I will make is, I think she is a phenomenal addition to the board. She has a tremendous wealth of information and experience. And I look forward to working with her again. Welcome.
Thank you. And I'll send your check in the mail. No, thank you. Thanks, Henry. It's fun to be on this with you.
I think Henry's your top recruiter. He got me here, he got you.
Yeah.
Oh, actually, it's Sally again, but I wanted to mention that I was affiliated with SHU through when I was at Cambridge, a nursing home, health and rehab center. I supervised a number of graduate student clinicians through the SHU program there and got like a community award for that, which was pretty cool because it was just teaching students through their clinicals as graduate students. So beautiful spot and a lot of relationships there. So yay.
Very cool.
All right, well.
Anything else to discuss? If not, I'll entertain a motion to adjourn.
Motion.
So moved.
All right. Motion and a second. Any opposed? Hearing none, we are adjourned. It is 8:34. Thank you, everyone.
Thanks, everyone.